Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. It is December 30th, 2013. This is going to be the last Monday Minutes for the year. And I thought instead of focusing on like a clinical tip or maybe an operational type tip today, I thought I would talk about focusing in EMS and keeping your focus, especially when I'm mentioning day-to-day sort of activities. And what I'm going to talk about today is sort of common in EMS. I've seen it many, many times. And I'm hoping that if you're the type of person that is guilty of what I'm going to speak about, that you'll start trying to consider how your actions and how not being focused can affect you or your patients. And when I talk about keeping your focus, I'm talking about doing one thing at a time, focusing on the task at hand. Okay, and it could be something as simple as you're doing an IV start, or maybe you're drawing up a medication, or maybe you're just checking the ambulance out, right? Focusing on the task at hand so that it gets done correctly, it gets done professionally, and it doesn't look like you're looking at sort of like the next shiny object to move to before you're done with what you're doing at the time. Okay, you think about how we can make medication errors in the field if we're not doing something like this. How we can make errors when it comes to, let's say, cardioverting or defibrillating somebody if we're not paying attention to what we're doing, right? One thing at a time, focusing on that task at hand. Now, I'm going to just talk about a few things that I've noticed, and hopefully maybe you'll comment in the comments section about what I'm speaking about, and whether or not you've done this or guilty of it yourself, or maybe have had partners that are guilty of it. And maybe if you are guilty of it, or you have a partner that's guilty of it, you'll start trying to realize how this type of mentality and this type of sort of distracting behavior can affect you, and it can affect your patient. Now, remember, EMS guys, we all have a job, right? Maybe you're working a 911 shift, right? When you're working 911 and you're getting dispatched to assignments, you're going to calls, it entails a lot of different multitasking just for one particular job, right? The driving, 911 licensed sirens, the patient care, the paperwork, the skills and assessments you have to do, all very, very in-depth of what you have to do while you're on the call. What you shouldn't be is listening to the radio for other calls going on in your area that you cannot respond to, you cannot help with, and there's nothing you can do for the other calls and other assignments and other units that are in your area or in your facility or whatever the case may be. You cannot do anything for them, right? You were assigned a job, you're working 911, and you've got enough to do, okay? Again, that task in hand, you have enough to do without being distracted about another call. So say you're on an abdominal pain call, right? You're making patient contact, or you're in the back of the ambulance with the patient. You don't need to be listening to the radio and hearing, let's say, a cardiac arrest call or a trauma call, or maybe even a critical pediatric call that comes over, and then start either commenting to your partner about that call, or wishing you were on it, or trying to hurry up on the call you're on to maybe go help on that call, right? Focus on the task at hand, guys. You've got that job to do, and your patient doesn't want to see you being unprofessional, not giving them your full attention, okay? And don't forget, that professional attitude also reflects on your agency as well. So keep all that in mind. Now, the same thing goes when you're working, let's say, at an interfacility sort of a truck, right? If you're working interfacility or take-home sort of ambulance, you don't need to be listening to the 911 radio, right? You're not going to respond to the 911 call. You're not going to do it, right? You're on that assignment already. You're not going to be responding to the 911 call. You're not going to be responding to other assignments. Yes, interfacility calls can be boring. They can be rather routine. But again, you have a job, right? You have a task. Focus on the task at hand. If you're doing interfacility transports for that day, or maybe that's your full-time job, focus on that. Be the best that you can in doing that job. Focus on the paperwork, the documentation, where patients are going, reports from the nurse, reports you're going to be giving to the receiving facility, understanding where you're going, where you're coming from, okay? The time, okay, a lot of interfacility transports are time. You have scheduled pickup times, scheduled drop off times, all important things that you need to be focusing on, in addition to your basic assessments that you should be doing on interfacility calls. Your basic patient assessment you should be doing when you're transporting these patients. Don't be focusing on other assignments, upcoming assignments, the 911 radio that you might have access to, and listening to the 911 crews getting calls. This is not what you should be doing. You should be focusing on that interfacility transport or that take home, giving the patient your full attention, giving the road in front of you your full attention, the paperwork your full attention. I think you get the idea what I'm trying to get at here, but just think that on top of being distracted, on top of looking at other things, you can come off as being unprofessional, as being non-caring to your patient, or even to your partner, where your partner is looking to you to be just that, a partner. They're not looking for you to be looking at other jobs and having this wandering eye, this wandering mindset while you're working with them. They need a partner. They want you to be as focused as they are. Okay, all little things that I'm trying to get across here, guys, okay, is to stay focused. Focus on that task at hand and think about the one thing at a time. Every job has multiple tasks. You should be multitasking on every job to begin with. But when you talk about assignments, you talk about 911 versus interfacility, things like that, your focus is going to be multitasking as it is. You don't need to be thinking about other outside sort of influences that can be distracting you to the job that you have. And finally, guys, I mentioned this throughout: listening to the radios, answering your cell phones, worrying about if somebody's going to call you because you know somebody that's on the other truck that was on that heavy trauma job and you were on the abdominal pain or the fever job or the interfacility transport, and you're waiting for a phone call to find out what happened and who was there and how bad it was and all that stuff. You don't need to be thinking about this stuff while you are on your assignment, while you are on the calls, while you are doing paperwork and you are responding to or from an assignment, whatever the case may be. Focus on the task at hand, guys. Don't use the radios and phones for anything other than the assignment that you're on, whether it's 911 or interfacility, okay? Focus on the job you have. Focus on the task at hand. And I think you're going to find that it's going to be much more easier for you to get these jobs done. You're going to find yourself much more focused to get them done. You'll be getting done quicker. And then when you have that downtime, you've got that time, free time, you can go ahead and listen to the other calls going on all you want. Look to pick up other calls that are in your area, or assist units in the area, whatever the case may be, after you're done with that assignment. Again, focus on the task in hand, guys, and remember, you've got a job to do, okay? And it's one job at a time, and you might have heard that saying, one job at a time, every job is success, and that's what you should be focusing on. Guys, listen, I hope you can use these Monday Minutes. I hope maybe they've opened your eyes to maybe focusing a little bit more on things. If you've got a partner or you've seen people do things like I've mentioned, maybe point out to them the importance of them focusing on that task at hand and focusing on the job that they have at the time. Okay, everything gets involved with that. Everything from your perception to the patient and your partner and other professionals that are out there, to even safety when you're driving ambulances and you're doing things like drawing up medications and whatnot. Okay, all these things, guys, tying together and play a role in our day-to-day activities in EMS. Like, I hope you'll think about this when you are in a situation or find yourself with a partner who might be in that situation in the future, in the coming year to come. So if you have some minutes of your own, guys, don't forget, send them over to me. In the meantime, I don't know if you've seen the past few Monday Minutes. I've been trying to offer this free report here. And this is sort of a quick paramedic study reference, and it's kind of designed to help you know some of the key elements that are often seen on EMS exams So you can check this out. It's a small version of some of the bigger things that go on the website, but it's free. Click on this graphic and go access to this report. Guys, that's it for me and the Monday Minutes here at EMS Office Hours. Again, hope you can use them. Send me your own suggestions over to contact@emsofficehours.com. Until next week, guys, as always, and next year, as always, stay safe.